Ladies and gentlemen, thank you for standing by. Welcome to the Working in Teams Accreditation Preparation Tips from Those Who Know webinar. During the presentation, all participants will be in a listen-only mode. If you'd like to ask a question during the presentation, chat feature located at the lower left corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Monday, February 20, 2014. I'd now like to turn the conference over to Lowry Ward with NACCHO. Please go ahead, ma'am.
Good afternoon. My name is Lowry Ward, and on behalf of the National Association of County and City Health Officials, or NACCHO, I'm very pleased to welcome you to this online program. Today's webinar is titled Working in Teams, Accreditation Preparation Tips from Those Who Know, and it's the 25th in NACCHO's Accreditation Preparation and Performance Improvement Series. We'd like to take a second to apologize for the schedule change. This webinar was supposed to be the week before last, but due to inclement weather in DC, where NACCHO is based, we had to reschedule for today. So sorry for any inconvenience, and we hope you still enjoy the program. As a reminder, today's 90-minute webinar is being recorded, and the sound is, or should be, broadcasting through the speakers of your computer. If you have problems with or do not have computer audio, and you have called into the telephone line to hear this audio, please note that all participant lines are muted and will stay muted during the broadcast. The slide presentation was emailed to registrants on Friday. If you didn't receive them, you can download them on NACCHO's website at www.naccho.org/accreditation/webinars. We will also send out a link to the slides after today's presentation. As always, at the end of this program, there will be a general question and answer session. You may ask a question at any point during this web conference simply by typing a question into the chat box in the lower left-hand corner of your screen. We hold all the questions for the Q&A session at the end, and we'll do our best to get to all of them. Your participation is key to the webinar, so please don't be afraid to ask questions. At the end of the program, you'll be automatically directed to an online evaluation. It only takes 2 minutes, and we use the feedback a lot as we improve our webinar series, so please take a minute to fill it out when today's webinar is over. The overall goal of today's webinar is to describe options for structuring accreditation teams and organizational practices that local health departments need for accreditation. It's our hope that this webinar will result in participant knowledge of lessons learned related to accreditation team structures and participant roles, as well as participant understanding of different perspectives related to accreditation documentation collection, and participant insight into the FAB site visit process. Again, remember there will be a general question and answer session towards the end of our presentation, so don't forget to send in your questions for any and all the presenters or for NACCHO, and use the chat box to do that. We're very excited about both of the speakers on today's program. Between the two of them, there's a wealth of knowledge and a variety of perspectives related to accreditation. Dana Webb-Randall serves as the Accreditation Coordinator for Caddo, Comanche, Cotton, and Kiowa County Health Departments in Oklahoma, where she coordinates accreditation activities, chairs the QI teams, and facilitates strategic planning and implementation efforts throughout the agencies. Under her guidance, Comanche County Health Department became one of the first accredited by FAB. Dana has more than 11 years of experience administering nonprofit organization programs and projects, including community development efforts, strategic planning, researching and writing funding proposals, and creating and developing programs around creative and cultural issues. Our second speaker is Mary Cushion. Prior to her retirement in 2013, Ms. Cushion served as the health officer for the Central Michigan District Health Department. It's a position she held since 1993 during her 25-year career in local public health. Ms. Cushion is now providing consulting services in the areas of national accreditation preparation and population health coalition development. Ms. Cushion was a member of the FAB Standards Development Work Group, and she also served on the Research and Evaluation Work Group for the CDC's and Robert Wood Johnson Foundation's Exploring Accreditation Project. She's a trained FAB reviewer and led the Central Michigan District Health Department to become nationally accredited in August of 2013. She serves as on the FAB Accreditation Improvement Committee, and she's a member of the National Quality Improvement Exchange Advisory Panel. Ms. Cushion also served on the Michigan Local Public Health Accreditation Commission and has served in the NACCHO Accreditation Preparation and QI Work Group. So as you can see, both of our speakers are very well qualified to present on this topic today. I wanted to take a minute and just talk about the agenda for today's webinar. It's going to be divided into 2 presentations and then that question and answer session I keep mentioning. So our first speaker, Dana Webb-Randall, she's been the accreditation coordinator at Comanche County in Oklahoma for several years. She successfully led the agency through the accreditation progress, and Comanche was one of the first sites to be accredited in February 2013, as we just said. Since then, she's begun the process with other local health departments in Oklahoma and worked with the state health department to train and mentor other agencies. She's been involved in many national peer networking groups and has great insight into the accreditation process at many health departments, so different sizes, governance structures, etc. Mary Cushion also served as a health officer for our health department that received accreditation in 2013. She will be primarily speaking to us today, however, from her point of view as a FAB site visitor. She served as a FAB site visitor twice during FAB's beta test, and since program launch has volunteered her time on 1 FAB site visit and is currently on the team for another upcoming site visit. She also consulted several other FAB site visitors for the content of her presentation today. Please keep in mind that due to the nature of FAB's program, Mary is unable to share specific details of where she served as a site visitor. She will be speaking in generalities today while keeping the confidentiality and integrity of the site visitor role intact. So today we're going to be talking about accreditation preparation and hearing tips from both sides of the aisle, so to speak. After their presentations, it will be your chance to get answers to your burning questions, so please submit them during the presentation and we'll try to get to them all. All right, so before we get started, let's hear about you and your accreditation journeys. So I'm going to put a poll up on the screen, and please take a second to tell us where you are in your accreditation preparation efforts. All right, thanks for those of you who are answering. I'm going to put the results on the screen so you can see as a few more answers come in. It looks like a few of us on the call are already accredited and a few aren't sure about when they're applying, but most folks are planning to apply either this year or next year. So that is great, and that's typically what we have seen in most of our webinars, so it's good to see that sort of a distribution from all around the process. All right, I'm going to close the poll there. Okay, so thank you for participating in the poll. We'll have one more a little bit later in between presentations. But now let's start with hearing from our presenters. So I'm going to turn it over to Dana Webb-Randall. Dana, take it away.
Okay, I'd like to thank everyone for calling in and listening today, and I hope that I'm able to impart some sort of knowledge that will help you on this journey, because it is definitely a journey. So here in Comanche County, we have about 126,000 people. You see there our mean household income is about $56,000. Our racial breakdown, mostly white, some African American, definitely an American Indian presence, as in across the state of Oklahoma. 12% Hispanic. 13% of our population receives SNAP benefits and 55% free or reduced lunch. So here at the health department, we have 62 employees. 6 of those are senior leaders, and we had about 15 of those who were on our FAB team. So you may be asking yourself why accreditation, or if you're an accreditation coordinator, your staff may be asking you why accreditation. The big thing is that now we have standards. We have these national standards that really give us a measurement of how we're doing in the kinds of things that we do to reach out community and sort of impart public health in the community setting. It is all about the standards, and we now have a universal set of those standards by which we can measure our efficiency and our effectiveness. So in terms of assurance, just having these standards, I believe, offers us assurances that we're doing a good job in continually assessing ourselves and our processes. So this is a way of assuring ourselves that we're doing what we would like to do the best way that we can. And then in terms of continuous improvement, it forces us to actively seek out areas of improvement, makes them more easily identifiable, and gives us guidance for our improvement. So by looking at the standards, I know for us, we're able to go through and see, the kinds of documentation we had, where we could improve. It was sort of a gap analysis all the way through the process in terms of what kinds of things we already had in place, what kinds of things we could improve on, and what sort of processes that we needed to put in place. And so in terms of staff engagement, this is where we really level the playing field, and we really meet staff where they are. You really want to talk with your staff and not at your staff to explain the process. And I believe if you are an accreditation coordinator, then your goal is to help them understand that they already know this stuff and that the health department will rely on them for their area of expertise. Try not to be condescending or present accreditation as some sort of pie in the sky that will be virtually impossible to meet, because it can be done. And then meet staff where they are, as I mentioned before. Walk them into the understanding of the real meaning of accreditation and how your health department is going to get there. So you want to just make this very real for them as they go along this process. And, sometimes, you say accreditation and it sounds very scary, but the reality is it's the 10 essential public health services. It's what we do. So there's every person in the health department can attribute to this and have something to offer to the goal of actually being an accredited health department. You want to inform everyone, convey that all levels and areas in the agency contribute to the process in some way. Every employee has something to offer. And lastly, and I think probably most importantly, is that you are the cheerleader. So it's up to you to really plant the seed of positivity. Don't approach it like, I know everybody has a lot of things to do, but we still want to work. Really be upbeat about the process. And I've found that's really contagious. If you're really positive about it, then people are less hesitant and they're more willing to buy into the idea of accreditation and this whole agency-wide quality improvement effort. And so your team, they are really the subject matter experts, and you, if you're the accreditation coordinator, you are the facilitator. You're the one who prods it along. What you should do, I think, as an accreditation coordinator, you need to set those process timelines to keep folks on track. They should know how long you anticipate each stage of the process should take, and have a projection of when the process will be complete as much as you can. So you don't want to keep them guessing in terms of where you are with the process. And I think that meetings, maybe monthly meetings starting out and then possibly moving to weekly meetings to just make sure that everybody is engaged and knows where you are in the process. Also, I think it's good to let them loose and yet hold them accountable. So again, create regular times to meet to discuss. So if you meet with your team once a month, then give them some deliverables, some things to work on during that month. Let them loose to really work on those things and collect that documentation and come back and discuss, what were the challenges, what things were easy, where do we need to provide more effort or more focus to shore up some of those processes. You want to prod them along in the process. And it's better if you keep the momentum going and not allow a lot of lag time. I know for us, we went through this process pretty quickly. And so for us, it was very intense for a while, but I think that kept everybody's feet to the fire in terms of getting that documentation, and there was no lag time in the process. And lastly, you really want to be the wind beneath their wings in terms of your staff. They can fly on their own, meaning they can identify and possibly pull that documentation because, once again, they're the subject matter expertise, but they may need some support that looks like an interpretation of a measure, help with identifying nuances and details in a measure, or a connection to the overall intention of the measure. So there, you're really there for that interpretation, but they really know where to find that documentation and know what documentation really needs to be submitted in most instances. Okay, I have just done something. Larry, I need help.
Sure. Do you want to be on the slide after the one you were just talking about, right there?
Yes, I think that's it. Thank you.
You're welcome.
Okay, so in terms of choosing the team, this is actually what our domain team looks like for all 12 of our domains. Like I said, we had about 15 people who were on the FAB team, and each person served on at least 3 domain teams. And so the way that we put this together is our administrator called a meeting of the people that he chose to be on the FAB team. He briefly presented on each domain, and then he had the team, and at that point I was on that team. We actually self-selected which 3 domains that we should participate on. So we selected and he projected those up. And then he actually showed us where he had us on the different domain teams, and only one person didn't select one domain where they were supposed to be. So what that told me is we recognized where we fell in the process of accreditation, and there wasn't really a lot of mismatch. We knew where we fell, and that's where we were able to contribute, and that was the reality in the end. So that worked out. It did come to light that later on we added some people to the teams that we didn't originally have, that we didn't know needed to be involved, but that worked on fine as well because everyone was willing to help in any way that they could. Skipping. Okay. And then in terms of leadership, you really look to leadership to convey the significance and the importance, and to really be upbeat about it, be supportive of the efforts of accreditation. And I was really blessed in my county where Keith Reed was the administrator when I first started out. And Keith was a huge proponent of accreditation. And I mean, everybody knew that he was very excited about this process and that he just supported it 100%. And that just kind of filtered down into staff members really buying into that positive outlook on accreditation as well. Also, leadership should be willing to spend time on the effort, planning strategies for how to best engage staff, offering additional interpretation of a measure, and staff should see leaders as an integral part of the process and see themselves as an integral part of the process, and see their leaders as steadfast supporters. If it's important to your leader, then there's a better chance that it's going to be important to most folks in your agency. So really putting that leader out there and letting them share how significant it is as you come along and facilitate that process. So you really do this process hand in hand. In terms of documentation collection, we did start with the full team meetings. And then we had, that initial meeting where we set up our domain teams. And then we had each domain team sort of meet by themselves, and I was there if I needed to be. But sometimes it was just them going to the measures, getting familiar with them, what kinds of documentation could they use, where did they see gaps in the process in terms of, how the health department operated, and just had those monthly for a while. During that process, actually right at the beginning of the process, we went ahead and built those shared folders that were, it was a domain folder and then the standard and then the measure. And we actually let our domain teams put documentation into those measure folders if they felt comfortable with that. And if they had a question as to which one would go best, we encouraged them to go ahead and put, the several examples in there, and just reassure them that before we actually submitted, that the accreditation coordinator or I was going to sit down and talk with them and help them determine what was the best piece of documentation to move forward. So we really had them dump in their opinions of what the best documentation was, and then reviewed it with them to make sure that we were all in agreement. Then I met with those individual domain teams, like I said, and we weeded through, if there were 4 examples, we cut it down to how many we needed, and just helped them select the best documentation. Helped weed out things that were unnecessary, if it was extra stuff, because staff doesn't really like to see extra documentation put in there. And then we did one last meeting before we actually submitted, where we solidified the final set of documentation, where we actually went through and said, okay, this is what we are submitting. And everybody was in full agreement before we decided that those were the documentations we were going to submit for that particular measure. I would say here, don't really get stuck in the beauty in terms of your documentation. Just make sure that all the aspects of that measure are in there. And if you're trying to guide someone to try to find documentation and your team appears to be stuck, it's really important to reread that entire measure, because sometimes you can miss some of the nuances or the significances if you just read a part, just the guidance, or just a piece of it as opposed to the entire measure. In terms of document descriptions, you want to put those descriptions in there, how it meets the measure. Make sure you reference if you have highlights in there, if there are page references or paragraphs, anything like that. Be as specific as you can in terms of pointing to what part of the document that the site visitor needs to look at. And also, you want to use those measure descriptions that it's sort of the description for all the documents that you submit, and tie it all together if you need to. So, for example, for one of our measures, it calls for something where it could have been one document that met the measure, but for us, it was 3 or 4 documents that met the measure. Well, we took that measure description to really tie all that together to make that clear for the site visitor in terms of why these 3 documents meet this measure, all put together as one. And then for our documentation tracking, up in the beginning, we did an Excel spreadsheet where we talked about, we just had like the measure and then how we felt we were doing in that measure, if we felt there were any challenges or any gaps, and I'm going to show you a screenshot of that in just a minute. And then as we progressed along the process, we did a Word document that had more detailed progress of the things that we were missing, or the things that we needed to add or look at or shore up. And then the items that we tracked whether the measure description was complete, so that one that ties in all the documents, any issues with the documentation, whether there was still documentation that needed to be collected, a self-assessment. We actually scored ourselves using the FAB scoring in terms of how we think we did in that, and then where to look for additional documentation. I know one time we were stuck on one of our community engagement pieces, and we just took out a flip chart and just brainstormed on all the places where we did any kind of community engagement activity, and were able to just remember all the things that we did and pull from that documentation, because otherwise, if we hadn't done that as a group, we may not have thought to look to Living Longer, Living Stronger, or CATCH program, or something that that we do, but we do it so often we may not have thought about that right up front. And then that final pass for dates and signatures and logos, I can't stress this enough. This is one of the lessons learned. If I could have done it again, I would have done a more thorough job of just making sure that everything was dated and signed and had the appropriate logos to validate that documentation. Then for the tracking, this is a screenshot of the Excel spreadsheet that we did. And as you can see, the domain, the standard, the measure, where we felt like we would have scored had a site visitor come in, and then our notes. We just had notes off the side. And this sort of guided us through those FAB whole team meetings in terms of where we were in collecting documentation. And then this is the Word document where we were able to put more descriptive information as we got closer to getting ready to actually apply. And the color-coded, we did those things for red, the stuff that we needed to upload, if we needed additional information. And so I kept this along with, I had a person on my team who worked alongside me to help with the process, and then our administrator, and we circulated that among the 3 of us just to keep us on track with where we were in the process. And then for the site visit, really it's a lot of it is about organization. Do whatever works for you and your sanity to keep aware of everything that's happening for the site visit as you're preparing for the site visit. If you're not naturally very organized, you'll also be fine, but you will need to put those mechanisms in place. And so pull a team together to prepare for that site visit. You don't want to try to do that by yourself in your office when they come, because people will think about things that you can do to make that site visit go easier in a group, more so than I think you would do on your own. If you tend not to busy yourself in the weeds on a normal day-to-day basis, now is the time to start, because there are just so many different things that are going on simultaneously. You have 3 interviews going on simultaneously. You can't be in every room. No one can be in all 3 places at the same time, so you really kind of have to have a handle on what that day is going to look like. In terms of logistics, again, you want to partner with different people in your agency just to solidify all those logistics, all those things that are going to make that process go easily for you. One of the things that we did, we even though everything is electronically uploaded into eFab, we had binders for all of our documentation in hard copy. Not something that you have to have, but we had that. And then after you submit your documentation, you'll get questions from your site visitors, and they'll want more information. Some of the measures, they're open so you can upload additional information information. Some of them, they'll just have questions. So we, in addition to our regular binders, we had supplemental binders where any additional documentation that we used to answer a question or that we uploaded, we had those in supplemental binders and accessible to the site visitors. And they did ask to see those several times. So that was a really good use of our resources to have those available for them and just in the site visitor room during that interview. Your adrenaline is going to be pumping, and you want so badly for everything to go well. So you really need to anticipate what you'll need and pull others in to help you determine what you'll need. You just won't be able to think of everything. In terms of revelations, I think the whole site visit process, it really opened our eyes to what could be improved on in our health department in a real upfront, undeniable kind of way. I mean, you have these very candid, in my opinion, candid conversations with site visitors, and you really drill down if there are any kind of questions about how our process flows. You're given the opportunity to explain that in a comprehensive way. But it really, I mean, we walked away understanding where we needed to make those improvements, and it was just very useful for us. It really, the process forced us to address our health department's weaknesses, to be frank. And then it just helped us understand, in general, how we can do some things better. And that is all that I have. The only other thing is we're getting ready to, well, we're working on our first year of reporting now, just trying to get all that information together to submit that to FAB. And then across the state of Oklahoma, our accreditation coordinators meet monthly, and we sort of do a mini gap analysis, go through each domain and talk about the kinds of things we have in our health department. So we really rely on each other in the state of Oklahoma to try to be successful and help all the other counties to be successful as well. And I'm just really proud of the partnerships that we've developed there. And that's all of my presentation, so now I'll turn it back over to Lowry.
Thank you, Dana. And yes, the health departments in the state of Oklahoma do work really well together. I love hearing stories like that. And for those of you who don't know, the Oklahoma State Department of Health was accredited at the same time that Comanche County was in February of 2012, I believe. So thank you all for submitting in questions for Dana for during that presentation. We will get to as many of them as we can at the end of our presentation when we have our question and answer session. So keep them coming. We are organizing them all. Before we go to our second presenter, we're going to do another poll. I want to know about the accreditation teams for you all out there on the webinar. So tell us a little bit about your team. Check as many of these as apply. If you don't have a team yet, there's a box for that. Some teams are mostly managers and some are mostly frontline staff, or you can check both if you're half and half. Some teams are small, like less than 10 people. Some are big, more than 10 people. Do you meet regularly already? Do you have excited members? If those are not yet happening, you can not check those. So you don't have to say if they're not excited. But I'm going to show you all the results so we can see. It looks like we're seeing more teams that are comprised of mostly managers, and that is pretty consistent with what we hear from the field. More teams that are smaller than 10 people. So that probably has to do with size of agencies on the line. But it looks like most of the teams that are represented on this webinar are meeting regularly, which, as we all know and we hear about from many health departments, is a very important part of the process. So that is great to see. And about, looks like 30-ish% of us are saying we have engaged and excited teams. All right, so now we're going to hear from the site visitor perspective. When we were planning this webinar, this was something that I think Mary actually suggested adding the site visitor component to us, and we thought it was a really great idea because we know that accreditation coordinators and also just folks just getting started with this out there in the field really want to hear about this part of the process because it sounds intimidating and scary, but it's something that is really important and a wonderful part of the accreditation process. So Mary, we're very excited to hear your insights, so take it away.
All right. Well, thank you, Lowry, and again, thanks to NACCHO for their willingness to sponsor this webinar today. And also, thanks to all of you for joining in and rescheduling in your schedules to make this happen today. Also, I just want to give a quick thanks and shout out to the site visitors that are on the call. There are several that as I'm scrolling down and looking at the participant list who I talked to in advance of today's webinar to be able to get their insights as well. So it's certainly much of what I've learned as being a site visitor, but also it is a team effort, and so I did also incorporate several of their suggestions as well. So for those of you that are going through, and I know that some of you haven't applied yet based on the first poll, but are planning to do so, really what you should expect from a FAB site visit team is, and this is right from FAB language, but a thorough and rigorous review. Certainly FAB, in their collective wisdom, did the right thing in having peers go out and be the site visit teams for these health departments, because we've been in the field, as Lowry mentioned and as Dana mentioned, that there are applicants who are also site visitors. There are site visitors such as myself who is also an applicant. So we want to do a thorough and rigorous review. We know what we want to look for. We know what we want to see. And as a result of that, we'll provide you back with comments in areas where we've seen applicants excel, and also give some recommendations for where improvements should be considered. Please recognize and know that we need to learn a lot about your agency in a very short amount of time. And so the majority of the comments that I'm going to provide today from a site visitor's perspective is really trying to give you some guidance on how to construct that documentation and the evidence so that we can learn as much as we can about your organization to be able to provide that review in a very short, relatively short amount of time. So the first insight is, and Dana mentioned this as well, is read, and then read again. Really do take the time to go through and carefully look at the standards and measures. This is important for several reasons. The first one is that you want to make sure that you're ready to apply. You don't want to rush the process. FAB is not going anywhere. They will be there when you're ready to apply. So certainly when you feel that as you've gone through the standards and measures, and you are thinking and saying, yes, we have this, or yes, I think we can get that piece of documentation, but become very familiar with the standards and measures even before you decide to apply, so you can start gathering those types of information or preparing the documentation so that it does meet the FAB standards and measures. So it's really important to review what FAB is requesting. Is it asking you to describe what was done, or maybe how it was done, or who was involved in getting it done? A FAB site visitor, if we need to see a contact list or a surveillance list or whatever of who it is, it just bogs down the process if we get the list of how it was done, of how you came up with those folks. So really pay attention to the very critical details of what the measures are requiring. And then you will hear me say this several times, and Dana referenced it in hers too, that if we if the measure asks for 2 examples, that's sufficient. Dana mentioned in her remarks that they may have had 4 examples. They didn't load 4 examples. They loaded 2 examples, the 2 that they thought were the best. So again, be very, very cognizant that if the measure asks for 2 examples, load 2 examples. Don't load 4 or 10. Insight number 2 follows right up with that. More is not always better. For many measures, an excerpt is an acceptable evidence for that particular measure. So for example, it may be your emergency operations plan. It may be your communicable disease manual. It could be your risk communications plan. Throughout the FAB standards and measures, there will be places where they will ask for specific pieces of those plans. If you need to, certainly go ahead and load that document, but if you can, just highlight a couple of pages and pull out those couple of pages and load those. That's also in most times acceptable, as long as you can reference back the date and that there's reference to the health department. That's fine. The reviewers can always ask for more if they want to see an additional documentation. It may be an appendix that's later on that's referenced in that particular excerpt, but probably more is not always better. Avoid, again, tossing in extra examples. Give us your best. The review team, the site visit team, we review every piece of documentation that gets submitted into the EFAB system. And we will always do that. But it is helpful that we don't want it to be excessive or confusing, because it looks to us at sometimes of, well, you just tossed in a lot of different things, hoping that one of them will stick. Freestanding documents are always preferred to buried in reports. So again, if you can pull out that particular piece from a manual or from a report or from a set of meeting minutes, that's always preferable to being able to having to scroll down. One of the site visitors that provided their input into this presentation called it wanting to avoid scroll down fatigue. And we have seen, I have personally seen documentation that was, 500-600 pages. And the piece that I needed to review for that particular measure was buried somewhere in the 400 or 500 page mark. Well, it takes quite a while to load a 500 page PDF, so to scroll down just does take some time. Also, when submitting links from websites, those are great examples most times of documentation where you can provide them, but make sure that you have somebody click on that link in the EFAB system to make sure that it's active. I would also recommend to avoid the temptation of making any sort of major changes or improvements, even if they are improvements, in those links after you've submitted them. Because if you're wanting to demonstrate a certain aspect of a website and then that link gets changed or the website gets changed, then it's not there when the reviewer goes and clicks on it. So just make sure that the links are open and active. Insight number 3, several of you probably, again, I'm basing that solely on the response to that you haven't applied to FAB yet, but FAB has this great electronic document submission called EFAB. And one of the features in EFAB is the document description feature. We, as site visitors, really do read these and rely on these. And I'll show you an example here in just a minute, but it allows you to point virtually where that document in the evidence is located. And then it gives details on which element of the measure the documentation serves as evidence. So I'm going to give you a couple examples here of what I mean by using the document description feature and how it would help a site visitor if you used it in a more detailed way. So for example, this is a generic document in EFAB where, and you can see the arrow pointing down, this is the document description, or I like to call it the hover, because what happens is when you, as a site visitor, go and to review this particular piece of documentation, when I take my mouse and I hover over access to care talking points, this is this other document where it says the document was developed for members, blah, blah, blah. This pops up. This tells me exactly why the health department has loaded this particular piece of documentation to meet the measure. So definitely make use of the documentation description. And then another good way and another good use of this documentation description feature is, again, in measure right now, currently in measure 5.3.2, you can see that there are several required elements in this particular document. So this is for your strategic plan, and it says the strategic plan must include all of the following, and it has list A through F. So as a site visitor, then if I don't, I will probably read your entire strategic plan, but if I need to know for this particular measure, is there a mission, vision, and guiding principles? Are there strategic priorities? Are there goals and objectives? I have to go as a site visitor and I have to make sure that all of those elements have been addressed within your strategic plan. So when you load your strategic plan, it's very helpful if in that, again, that document description, and this is, again, this is just an example, and I'm using it for a community health improvement plan, but you can say, see page 4 for evidence required for the elements of A, the mission, vision, and guiding principles. See page 10 for the evidence required for B, the strategic priorities. So the more clear and concise and detailed explanation of pointing that site visitor to the places that you want them to see in that strategic plan, then the better the review will go. The site visitor will be able to go right to that and be able to say, yep, they meet that, I found that. It's just super, super helpful. So again, it's a show and tell. Make sure that you tell the site visit team where we can find the evidence within the document. Make sure that the description, aligns with the PDF page number. Many of the documents that are loaded into the EFAB system are in PDF, and for whatever reason, when it gets converted to a PDF and then it gets loaded, we've seen this several times that, and you put in the description, that see page 6. And it may be page 6 on the original document, and if it is, that's great. Just make sure that you note that it's in the original document. But it could show up actually on page 8 of the PDF. So again, it's a minor thing, but if you can review and open that up in the EFAB system and say, okay, yes, it's on page 8 in the PDF, and then make your description in accordance with that, that's really helpful. Highlighting is also very helpful. Again, using arrows or text boxes prior to loading those up in the documents is really also very helpful. Making sure that we can open and read the document. A lot of times documents are back-to-back, and sometimes that back page bleeds through to the front. So again, just for readability purposes, the FAB accreditation specialists are very good at checking those things during the course of the review process. But again, if you can make sure that it's top to bottom and not facing sideways or upside down, that's also very helpful. And again, just referencing again to, if using the links, making sure they're active. And don't forget about there's an optional narrative section that I don't know, I haven't had a lot of experience. I know our health department, the Central Michigan District Health Department, we didn't use this a lot. But it is a good tool. It's something that is included in the EFAB system, and I believe it's worth mentioning. And so it's the health department narrative, and this really helps the site visitors understand why you submitted the documentation for that measure. If you can't fit it all in the little description or the hover, this gives you an opportunity to describe it in a little more depth and detail. This is especially important, I believe, if you think that the evidence is maybe not particularly strong, or why you submitted this particular piece of documentation. It may be that you recognize that it's not everything that it needs to be, and you want to be able to describe that and explain what your future processes are going to be. So again, it's just another opportunity to give the site visitors some insight into your thought processes as to why you loaded particular pieces of documentation. Insight number 4, again, be specific and concise. Select documents that are going to tell your story, but not War and Peace, not huge documents. They need to be focused. Again, they need to be readable. Also, if you're going to submit, I know that there are several measures whether it's working in partnerships and community engagement type activities, where one of the examples can be an agenda. I know as a site visitor that if you're going to submit an agenda, please also include either a sign-in sheet or signed and dated meeting minutes. Quite often, just like this webinar today, it was rescheduled. Meetings get canceled, meetings get postponed. So what you may have indicated that you were going to accomplish with that particular meeting agenda, the site visit team is just going to want to double check and make sure that that meeting actually occurred. So being able to have a sign-in sheet or signed and dated meeting minutes is beneficial. Again, making sure that the intent of the measure is met. That who, what, or how, it really, again, going through the guidance, making sure that the intent of the measure is met. Going back and looking at that guidance document is highly beneficial and well worth your time. Be mindful that there are some requests that FAB asks for, did you experience any barriers? Were there factors that caused problems? Don't shy away from those because, again, as a site visitor, if the intent of the measure is to show where there were barriers, that's what we're going to be looking for, are the barriers. So I think there are some health departments that may feel, oh, I don't want to, this is our best foot forward. I don't want to tell them about any problems that we encountered. But really, we understand life gets in the way. Public health is not perfect. No local health department is perfect. So we do want to know what the barriers were and then what you did to address them. So make sure that you include those. And then also make sure that you spell out acronyms. And this not in every set of meeting minutes, certainly, but for example, in the agency that I worked for, we all know what TWC is. It's Together We Can. A site visit team's not going to know what TWC is. So whether you can put that in the description hover or whether you can put that down in the narrative, but just some way to describe, to say this is our community engagement, this is our strategic planning team, this is our emergency preparedness team. If it's an acronym, at least identify it and spell out that acronym, and then use common language. And again, a legislature in Michigan is the state legislature. A legislature somewhere else may be their county commissioners, is what we call them. So making sure that you specify that if it's county, it's county, if it's state, or if it's federal, again, just that will help your site visit team. If you don't have it, again, say why. We understand that as you're going through the documentation, you may run into an issue that you don't have a particular piece of documentation. You may have an agency or a community health improvement plan that's less than a year old, and FAB is asking for annual updates to the plan or annual updates to your community health assessment or your strategic plan, and it may be a brand new plan, and so you haven't had a year's worth of experience. So if you don't have it, say why. I know that I have seen some examples where a memo from agency leadership explaining why you don't have it, but the process that you're going to pursue in the future will sometimes suffice to be able to meet that measure. I can't guarantee that you would get a fully demonstrated, but you'll probably get at least largely demonstrated by saying, we don't have it, but this is what we would do to be able to meet this measure on a go-forward basis. So just be cognizant of that it will avoid the site visitor having to ask, hey, why haven't you shown us your annual updates? If you don't have it, just say so, and then just load that piece of documentation in instead. Insight number 5, again, review before hitting the submit button. If possible, have a fresh set of eyes. Again, Dana talked about in Oklahoma that they've got this networking team of all the accreditation coordinators and that they work very well together. I would say that if you have the opportunity and you know of somebody else who may have gone through accreditation, somebody who's not going to be on your site visit team within your state, somebody who's familiar with accreditation, maybe just somebody within your own organization or community partner, just have a fresh set of eyes, being able to open the documentation, review it, make sure that the description and the title seem to match the documentation that was loaded. Again, making sure it can be opened, double check page numbers. So if you say in the description that it's on page 16, just scroll down to page 16, make sure it's there. Make sure that, again, that the titles match, and certainly make sure that it's dated, that it isn't in a track changes format, and it isn't marked as draft. Taking that time to review, Dana referenced it in her remarks, again, is time well invested before you hit that submit button. I also just want to mention briefly about meeting minutes, because so many of the measures do require meeting minutes, or it can be used as an example of evidence for a particular measure. So again, you're going to want to make sure that they're signed and dated, that they contain names, titles, and organizations represented. So for example, if you're needing to show that it's a community partnership and it's a sign-in sheet or a set of meeting minutes that go with that, you're going to want to make sure that people's names and as well as the organizations that they're affiliated with are on those meeting minutes. I don't remember the exact term, but you want to make sure that they're fab ready or fabitized or whatever term you want to use. But as you start developing meeting minutes and as you're reviewing and approving meeting minutes, making sure that they do have those, that they're signed and that they're dated and that they have names and organizations are certainly very beneficial when you're going back and needing to use those as evidence in a fab measure. And then also making sure that they're detailed. And I know this varies from organization to organization, and not always is the health department the one that's responsible for creating the meeting minutes. But if they could be a bit detailed, especially if you're using them for fab evidence. A simple sentence that I've used here is the example of the plan was reviewed probably won't get you a fully demonstrated because we want to know what was reviewed. Were there questions about the plan? What was good about it? What was the details around that? So we just want to make sure that if possible, that some more. This is the case where more is probably better than less. And number 6, make it a team effort. Dana, you saw in her slides, her administrator created a fab domain teams. I would concur with that. And again, during the site visit, your accreditation coordinator can't be in all of the interviews. And it's a quick 2-day site visit. And so there are concurrent interviews going on with the different domains. And so you're going to want to make sure that the people who are involved in the site visit and have been involved with loading the documentation, that they're very familiar when they go into the site visit, especially with the documentation that was submitted for their particular domains, so that when the site visitors may ask for some clarifying questions, that they know what's been loaded. I like the idea of a binder or bringing in laptops to be able to refer back to the documentation. I think is a good idea. So just making sure that as a team, you know what the documentation was that was loaded, and that there are common threads and themes that tend to run throughout the entire organization. So it does look like, that your environmental health director knows what your personal health director is doing, which the human resource director does, and so is finance, and so does the health officer. That it should be a cohesive unit. There are several times actually during the review process when a site visit team is going to ask questions or ask to have some of the measures reopened. And the reason for that is that we may need some verification or clarification of the document submitted. We may not be able to locate, for example, where in the document you want us to review. And this is particularly the case where it's a lengthy document. Or again, there may be one element of 6 that we couldn't find, and we're just asking for some additional clarification. We may need an additional example to conform with the intent of the measure. I know in the QI in Domain 9, there is a request for documentation where you have to show a QI initiative, one from an administrative area and one from a program area. If we believe as a site visit team that both of them are from program areas or both of them are from administrative areas, we just may ask you to load another document or another example from where we believe that you could provide some additional documentation to meet the intent of the measure. And it also prepares site visitors in advance of the site visit when we're going to be on site. If we can get a lot of the questions answered, again, some of the interviews that we host on site when we come to visit your health department are a half hour to 45 minutes long. So if we can get a lot of our questions and concerns answered in advance of the site visit, that just helps in the site visit process. Insight number 7, again, this is from the EFAB system, is the use of descriptive titles. And as I mentioned, again, I like this example. The first one is example 1, example 2. They've requested 2 examples. They've given a very specific title as to what is contained in each of those, and then you can see that there is a request for additional documentation. So they reference that right in the title, that this is the additional documentation that you've requested, and here's what it is. So again, as a site visitor, that's very helpful to know that I've already reviewed the first 2 pieces, that I've requested some additional documentation, and so this is what was loaded up as a result of that. Again, it helps you as an applicant know what you've added. It helps the site visit team go right to what that additional piece of documentation was that we requested. And then lastly, insight number 8. Remember that the site visit and really the whole accreditation process is your time to shine. So be confident in your team and in your staff, knowing that to get to the point of a FAB site visit is a remarkable accomplishment. And so celebrate that. During the site visit, make sure that you share stories that back up the documentation that was submitted. Remembering that the site visit team is there for those 2 days to seek clarification and affirmation of what you've submitted. So be willing to share your stories. Tell us what's behind the documentation that we may not have seen, or something that you're particularly proud of. There is, during the site visit, an opportunity to bring in community partners as part of the site visit, and so make sure that you select partners who do share your passion for public health, who are willing to share your stories, who know who, it's important that they know who you are, what their role is in helping the health department improve the health status to help meet the 10 essential public health services. This isn't on the slide, but I would say the same thing for your governing board members. Make sure that you have a very well-informed governing board and that they are also able to speak about FAB, about the health department, and that they share that same sense of pride. Make sure that you have access to the internet and the intranet, and that if passwords are needed for your site visit team, that those are ready when the team comes on site. And really keep in mind that many of the site visitors have also been or are applicants. We understand what you're going through. We've been there or will be going there ourselves. And so, we're going to try to make you as at ease and comfortable as we possibly can. Just recognize that we know that it's a stressful time for you as well. So with that, I thank you for your time and attention, and wish you the best of luck. And I will now turn it back over to Lowry. So thank you.
Thank you, Mary. Great presentation filled with lots of wonderful insights, as was our first presentation. So we're now going to come to the general question and answer session for today's program. As a reminder, if you'd like to ask a question, simply type it into the chat box in the lower left-hand corner of your screen. We've already gotten quite a few questions. We're going to try to get through them all. But just as a reminder, for any questions we don't get to and those we do, we send up written responses and answers to these questions after the webinar to all the folks who attended. So Dana, we have a couple questions that came in for you, so I'll start with those. The first one we got was, did you require your team members to watch the FAB online orientation? And if so, did they tell you it was worth it, or could it have been skipped for the whole team?
The entire team did not watch it, myself and the administrator, and that's it. And then he showed a small piece of it to the entire team, but not the whole thing. And I think they were fine with that. I don't feel like they missed anything by not listening in on that. That's just my opinion.
Gotcha. Thank you. And then another question that this is a question that I know I've heard quite a bit. How did you deal with any staff members that didn't see the importance of accreditation or thought it wasn't worth their time?
I think for me, it's the one-on-one relationships that you build with your colleagues in the office. Just really talking with them about the process and making it feel easy to them, and just making them or helping them understand that they have that expertise and they could very easily share, and you're really looking to them for guidance in terms of what's the best documentation to pull, but really pulling them into the process and letting them and helping them to see their value in the process. And that's just not a quick thing that happens over weeks, months. Even now, I think some people, the light bulb turns on now and it's like, oh, okay, but during the whole time of the process, they may have been resistant. It's just an ongoing developing a relationship and keeping those lines of communication open.
All right, thank you. So Mary, a question for you. We got several questions about this, basically with regards to meeting minutes being signed. Is this a physical signature, an electronic signature? And this is something we can actually get official language from FAB on as well when we send out follow-up information. But Mary, do you have any insight into that?
Well, first, what you just said is exactly correct, is that FAB has slightly modified, and I believe in version 1.5 there is some additional clarification about what a signature is. And so originally you had to have an actual physical signature. I believe it's changed now, as long as they are dated and that there is a logo or letterhead or something that designates who has created them, that is sufficient. But please do double check with FAB to make sure. I still like to see them signed, but as long as there's a letterhead or a logo and that they're dated, that's the most important thing.
All right, yes, and we will, just so for you all on the call to know, some of the questions that came in are questions that are better directed to the Public Health Accreditation Board, just because of their role in technical assistance and coordinating the process. So those that should be directed to FAB, I will be in touch with you all on how and who to contact at FAB and how to get in touch with them. So Mary, another question for you is, can you suggest the best way to upload excerpts of documents? Do you suggest cover sheets, table of contents, just your preference as a site reviewer?
Yeah, that's a great question. I would say a cover, even if it's just a paragraph description, saying this is an excerpt from our communicable disease manual. The table of contents is also very helpful, and then the actual just pages that you want us to be able to look at. And if you can add highlighting to those, what we need to see on those pages, that's even better.
Great, thank you. Okay, Dana, another question for you. How long did Comanche have to pull all the documentation together? I know your process was shortened, but how long total did it take you to do that part?
It was about a 5-month process for us.
Gotcha.
Understanding that we went through the beta test in 2009, but really, even though we referred back to some of the documents we submitted in the beta, we ended up pulling new documentation, because of timelines and those kinds of things.
Okay, and then another question specifically for you. You had mentioned, taking advantage of that narrative section where you talk about how all the documentation to meet a measure pulls together. Did you write those, or did you have your team assist you writing those, or how did that work?
We asked the team members to write those, but many times they didn't, or maybe didn't feel the need, and as I was reviewing them as a whole, I would go back and pull all that together. So even if they did it, sometimes I went, just kind of looked over it and made sure that it made everything very comprehensive. So in the end, I pretty much wrote those. Gotcha. Now for the individual documents, though, the team members wrote those.
Okay, yeah. So the team members wrote the individual ones, and then you worded the narratives.
Yes.
So how they fit together. Great. All right. Let's see. Okay, Mary, another question for you. When you were talking about, being careful to avoid that war and peace scenario, in your opinion, would it be better to cut and paste just an applicable section, or choose just a different example, or include the entire 600-page document and just reference the required page? Or are all acceptable, or only a few of those acceptable?
Certainly, they're all acceptable, and I understand that there are limitations to some in what they can. Some of them, they don't own the document, so to cut and paste is difficult. If you have to load up the county's personnel policies, for example, they may not. It may be you may get it in a PDF, and you can't cut and paste out of that. So that's understandable. It's again, from a site visitor's perspective, to have to scroll down through literally sometimes several hundred pages, that gets tough. So if you can use a snippet tool and create a separate document, if there's a way that you can have that excerpt, the site visit team, if we need to see more, we'll say, could you load the whole thing? Public health codes are a good one about that. That, we just need to see the excerpt of, what's applicable in a public health code to, for example, local public health departments or their governing authority. So to load up, the entire public health code is tough to get to that one page. So if there's another document, or if it's a way that a document can be developed to say these are our personnel policies, or this is the reference page. If we have to scroll, we have to scroll. I understand that, but it would be very helpful, where possible, to just load the pages that relate to that particular measure. We also understand that there, for example, in the Community Health Improvement Plan or the Community Health Assessment activities, that health departments will need to load the same document several times. And that's okay too. Just it may be on page 1 that we're looking at for one measure and page 21 for another measure. Don't be afraid to load the same document multiple times if it helps you meet those particular measures.
Thank you. That was another question we had got, so I'm glad you preempted that one. Dana, question for you. Since you are now thinking about reaccreditation, where would you recommend starting with reaccreditation if you're new to the position? So if an accreditation coordinator takes over after the health department is already accredited under a different accreditation coordinator, what would be your advice for sort of first thing to do?
I think you want to have an idea of what documents were submitted and the maintenance of those documents, so some sort of spreadsheet to show you when those documents need to be revisited and updated and revised, so you can get a handle on how often you have to revisit the documents. That is just that's just a very big, you could approach that just several different ways, but I think for me, my comfort would lie in understanding when I need to do those updates so that I don't fall behind anything as I get ready to apply again.
Thank you. All right, so we have another question here about documentation that an agency is sort of less than happy with or unsure about, so the documentation they're sort of least confident with. What is your advice, Dana, I guess, as an accreditation coordinator? Would you recommend being upfront with site visitors about that, or waiting to see if questions arise? And then Mary, you as a site visitor, what's your advice? So we'll start with Dana.
Well, I would have to say we just kind of put out there what we had and described it the best that we could, and if questions arose, then we addressed it then. But I like Mary's remarks and just being upfront. Now, when we were in the process of applying, that wasn't very realistic to us. They didn't feel very realistic to just put it out there, but hearing a site visitor say that they welcome that, I would be more inclined to do that the next time around.
Yeah, you certainly wouldn't. This is Mary. You certainly wouldn't want to say this is not the best, but it's all we've had to work with. I mean, toss it out there. If the site visit team wants to ask for some clarifying questions or ask for additional documentation, they can do that. But if it's what you have at the time and you're at least comfortable with it, otherwise, again, I'm talking about timelines and dates and all that. You have a year. So maybe there's, you say, well, I've got this set of this meeting and it was okay, but we're meeting again in a month. If the next set of minutes or the next report that's coming out, if you're still within that year timeline, take that time. It's going to be better. Site visitors can see in a heartbeat when things were rushed. And so I would really just recommend that you take your time, and if you have the opportunity to polish something up and make it look presentable by taking a few extra steps and a couple extra weeks to get it done, then do that. It'll make all the difference in the world.
Great advice. Thank you. Let's see. Dana, I know, can you describe to what degree the Board of Health was involved with accreditation? I know Oklahoma is centralized, but you still work with a board or no?
Yes, we have a local Board of Health, and our administrator was very good in keeping the Board of Health in the loop from the beginning. When we were first starting to talk about accreditation, they were very well versed. They know what it meant. And so they were just walked with us hand in hand through the entire process. So when it was time to have them in their Board of Health part at the site visit or the site visit part, it went really well. But there were no surprises. They knew it was coming, you know, and they were just very supportive for the whole entire time.
Great. And then another question specific, Dana, to your presentation. You had mentioned that on the site visit there were some questions you received where you had to sort of get out the supplemental documentation binder. And this kind of putting you on the spot, but can you remember a specific example of one of those or sort of a general domain area where that popped up?
For us, I believe it was in Domain 3, we're talking about communications. Well, what we uploaded were like the press release and then like the actual how it showed up in the media. We'd had those two documents, but we didn't have the documents showing the linkage as to how that press release information got, you know, evolved into a television interview. So what did the TV station call you? Do you reach out to them? How does that work? And FAB wants to see the process from that press release, it actually being in the media. So we were able to pull some of those emails to supplement that and just have those in a binder ready. And that was one of those things that was specifically requested because they wanted to see that entire process from beginning to end.
Thank you. Okay. Mary, I've got a question for you. From a site visit point of view, what would be your advice for a small health department? So with a staff size where everyone is going to have to be involved in the site visit, would you have any sort of special specific advice or just sort of the same generic overview?
Well, certainly if everybody's going to be involved, I guess I would hope that everybody had been involved right from the point of uploading the documentation, and so that everybody knows what FAB is, what it's about, why it's important, what's going to happen at the site visit, and the significance of that. Certainly, it's I don't know that it is any different. It's probably actually advantageous from a small health department's perspective because they are all actively engaged. Some of the larger departments, you may have staff that don't have anything to do with FAB, and that suddenly they're part of a FAB accredited health department. So again, I think it's just recognizing their efforts. And I'm going to put on my applicant hat for just a second, but one of the things that when myself as the director and our accreditation coordinator may have struggled to find a piece of documentation, it was always helpful and without fail helped us every single time that we sent out a request to staff saying, do you have this PowerPoint presentation? Do you have a sign-in sheet? Do you have a chart or a graph or something that we needed to be able to present? And having the staff almost do a scavenger hunt of who could come up with it first or provide us with examples really did allow the staff to be involved and let them feel appreciated that they were a part of the process. So rely on your staff when you can't find a piece of documentation. Chances are somebody has it tucked away in their computer or in their file folder somewhere, and they'll be able to pull it out for you.
Yes, that is definitely excellent advice. We've gotten a few questions sort of specific to the FAB site visit about how many days they are and how many site visits they are. Those are typically 2-day site visits with 3 FAB site visitors, but when you are going through the process with FAB, your accreditation specialist will coordinate your site visit team and communicate to you the process of your site visit. So that is something that FAB will let you know sort of well in advance of the process. A lot of the questions that are coming in, I want to make sure that we send the answers that are official FAB language. So some of you I will follow up with individually, and some of you I'll put answers in our sort of follow-up document with official FAB answers to your questions. At NACCHO we provide technical assistance around preparing for accreditation, which is why we can bring you programs like this. But FAB provides technical assistance around measure interpretation and sort of like EFAB specifics. And so a lot of the questions that are coming in are great questions, but I just want to make sure that you guys get the answers from FAB that you need. Okay, so we've heard, Dana, we've heard a lot of talk about having a binder, so having hard copies of documentation. Are all the documentation examples that you present to FAB required to be online? And if so, sort of why was there a need for a binder during your site visit?
Yes, everything does need to be uploaded into the eFAB system, but once you submit your documentation and you start getting the questions back from the site visitors, some of those measures they will reopen, and some of them they'll just ask a question. So we put together those supplemental binders just because we wanted to have them put together in case the site visitor would ask for those and would want to see those. So that was just us sort of going above and beyond in case that was requested. And also after we submitted, pushed the big red button and applied, I did make hard copy binders of all the documents that we submitted, and that was just on my own because I want to have a hard copy on my bookshelf, and domain teams did come in and reference those. You know, so that it's not a need, but it's something that we did just because it made us feel more comfortable.
Yeah, that's a great answer. I know here at Nature we work with a lot of accreditation coordinators, and I would say about 50-50 only use online, use eFAB, have their reserved documentation sort of on a cloud or on an internet, whereas about another 50% do keep a hard copy of everything just for their own peace of mind during the site visit. So it is completely up to you and your style as an accreditation coordinator or team. Dana, a few more specific questions about Comanche County. What is your position completely dedicated to accreditation, and if not, what are your other roles at the health departments where you work?
Well, I'm responsible for the accreditation of 4 health departments in our district. I also facilitate the QI projects or help others facilitate those in our areas, and I put together the strategic plans for each of those health departments. And also my background in general is community development, so I work with coalitions. I facilitate our CHIP, so any of that community engagement that goes around our community health improvement process, and therefore I'll be helping, I guess, facilitate the CHIP process and the MAP process for all 4 of those health departments. So I think that encompasses most of what I do.
Thank you for that. We did get a question that says, for the city-based departments that to follow their mayor or city council heavily for strategic plans, is that okay? I would refer you to, FAB has a documentation guidance document that's available on their website, and I will send it up with follow-up to this webinar. But there is a section there on documentation developed by others. It's section 12, and it talks about that particular incident and when health departments use documentation developed by either the city or the county or the larger entity that they are a part of, showing how they apply that to their governance and their work. So FAB has language on that I will share with follow-up and also include when I reach out to answer your questions. Okay, so I think we've gotten to most of the questions except for those that I've said are specific to FAB, and I will follow up as soon as possible on those. I do have a question sort of from both of you from your different perspectives through this process. How do you suggest adjusting your preparation efforts or your timelines due to turnover or changes in staff roles and responsibilities? I know this is something we get asked a lot here at NACCHO because in our field we're always wearing several hats and doing different work on different projects. So what would your advice be to health departments that are experiencing a lot of that, and how should they approach accreditation from that lens? So Mary, we'll start with you.
That's a great question. I would say, again, it goes back to your preparation and communication with your staff, that if they know about FAB and are aware of what the timelines are, that hopefully those that remain can continue on. But also again, there may be a bump in the road or a hiccup, and that you may just need to say, okay, we're gonna make sure that we're still on track. And again, once you've submitted, you have a year to get your documentation in. But where possible, and I know that it's not feasible everywhere, but where possible, FAB does allow that when you go to the coordinators training, that a health department can pay for a second person to go through the coordinators training. Because just as, again, I use this example all the time, but Lisa Silverman is an HO. When she says, when I win the lottery tomorrow, I need to know that everything in my desk is taken care of and ready to roll. So if your accreditation coordinator wins the lottery tomorrow, you're going to need to make sure that somebody else is prepared to carry the torch. And so just having a close working relationship with the accreditation coordinator with the other members of the staff, and certainly with the health department leadership, and to document. I mean, obviously the FAB process is all about documentation. So knowing where that documentation is, having it, whether it's on a shared Z drive somewhere on your system, or having people have access to the eFAB system once it's up and running, to be more inclusive rather than exclusive will certainly allow the process to move forward without hopefully too many speed bumps or hiccups.
Great advice. Dana, any extra thoughts on that issue and turnover or staff transitioning?
Yeah, I just exactly what Mary said, and just don't hoard the information. You know, if you are an accreditation coordinator, share, be transparent where things are, good relationship with your leadership, and also for the people who are on your FAB team who represent different service areas, if encourage them to share what's going on and where to find things and how they can be a part of that process, so that the left hand really knows what the right hand is doing, and so if there's some turnover that occurs, you're able to within a reasonable amount of time, keep that process flowing.
Excellent question. Okay, and a few more questions just came in. We got a question about our site reviewers from similar sized health departments, will rural review rural, etc. Well, again, I will sort of work on getting official answers from FAB to that question, but I do want to make sure that everyone on this webinar is aware that FAB site visitors go through a very rigorous selection process and a very intense sort of training process to ensure inter-rater reliability and things like that, and the process is constantly being evaluated and worked on. So the site visit teams are going to be prepared to conduct their role as site visitors because of the work that FAB does to prepare them for that. So another question that came in, and Dana, your thoughts on this, it sort of asks of the idea of how much it costs to go through accreditation, so not the fee, in terms of sort of like how much staff time was needed and other sort of infrastructural costs. Do you have any estimates on that, or any guidelines for thinking about that?
I really don't. I just know that we went through the process pretty intensely from the time that the measures were released, and so we were all working on it pretty intently. As the accreditation coordinator, of course, all of my time, so that complete, FTE was dedicated to that throughout that process. And I would not dare to guesstimate, but I would look to Mary to possibly do that.
Well, and yeah, I'm in a slightly different position only because I had the benefit and the blessings of being able to be on the standards development work group, and so knew what the standards were going to look like. And so in our agency, we did an analysis as soon as the FAB standards came out, and we developed our strategic plan around what we needed to do to meet the FAB standards. We based our strategic plan around the 10 essential services and being able to meet the FAB standards and measures. So we were geared up and ready to go. And then we just incorporated it into our work. We had our administrative staff meetings. We're geared around being able to develop and implement the goals and strategies that we wanted to include. So to put a dollar amount on it, I have no idea what it would be, because it was just part of our work. We made it our work. We made it our priority. We didn't let a lack of time or money. We just shifted our focus and made it made it our mission to meet those 10 essential public health services, which we then just parlayed into being able to meet the FAB standards and measures. So other than the staff time was, again, it was what we already incorporated into our work. Probably the only dollar amount that we had to put into it was, again, sending that second person to the FAB coordinator training so that we had a backup for our coordinator.
Great answer. Yeah, and that is something that a lot of the partner organizations have been trying to capture an answer for quite a while, and it's very difficult for several reasons. And a lot of those, were indicated in Mary's answer of making it part of doing business, quality improvement, and accreditation preparation. And then there's also, depending on how far along in the prerequisites you are, those have costs associated with them in terms of conducting assessments and processes. So a lot of those costs, as opposed to fees, are sort of more difficult to calculate. NACCHO has a series of short videos that we developed for boards of health where we talk about that a little bit and some things to sort of consider in the cost section. And so when I send out the follow-up for this webinar, I will include a link to that one. It's by no means comprehensive, but it's some things to think about as you begin to approach your board at the early phases of the preparation process. So. Again, thank you all so much for the questions you submitted, and we will be in touch very shortly with answers to those we didn't get to on today's presentation, or information about who at FAB to contact for answers to those questions. We also send out sort of a detailed follow-up document with all the answers to the questions, as well as some resources from NACCHO or FAB that would be useful. So as a reminder, when I disconnect the meeting in a second, you will be automatically directed to an online evaluation for today's webcast, and we'll also send that follow-up email where that link will be as well. So if you can't get to it today, you'll get it shortly. Rest assured your responses are anonymous, but your comments and suggestions are very important to us, and they help us come up with ideas for future webinars as well as improve the technology. For example, a lot of you are listening over your computers because we heard loud and clear from you all that you didn't want to have to dial into the phone and log into the computer. So things like that, we do listen to what you say and incorporate quality improvement and planning into our webinar series. I want to extend a very special thank you to our presenters, Dana Webb-Randall and Mary Cushion. The information you provided today was unbelievably valuable, and we know that it takes a lot of time and energy for you all on top of your other myriad of work assignments, so we really appreciate it. If you have additional questions for us, you can contact accreditprep@nacho.org. And the emails for the speakers were on their closing slides, but you can also send questions to NACCHO, and I will contact speakers or other folks to get answers for you. And again, thank you all so much for participating. We hope to see you in our next webinar. And this concludes today's program, so you may now disconnect.
Ladies and gentlemen, that does conclude our webinar. We thank you for your participation and ask that you please disconnect your line.